Thanks for the question. The question was about workforce shortages in the healthcare industry. And yes, we've been working on that for months, working with all the major healthcare facilities, including the nursing homes. We have directed more than, I think, $140 million to hospitals and nursing homes. Another $23 million, I think, we put in just a few weeks ago to help find work and help pay workers in the healthcare fields. We are also talking later today about allowing the hiring of new people who've been vaccinated at least once. We are working with every hospital system. As the Maine Sunday Telegram reported a couple of weeks ago, the vacancies that exist right now are not due to the vaccine mandate, they're due to pre-existing workforce issues in the healthcare industries. And we've been working on pumping up the career technical education centers and pumping up the Maine Community College system. If you were at the press conference about a week ago, I was at Southern Maine Community College, where we committed $35.5 million towards the new Alphon career training platforms, and to allow the training very soon of thousands of new healthcare workers. So we're increasing the pipeline, we're expanding the career opportunities, the career ladders for individuals who want to change careers and individuals of a younger age who want to start new careers. The question is, what can we do right now to address workforce shortages? Well, we are actually working with the hospitals and nursing homes across the state to address individual workforce issues, again, which predominantly predated the pandemic. And it varies from sector to sector. But we are working on increasing the pay of various healthcare workers and allowing the hospitals more funds to increase pay or to provide bonuses or, sort of signing bonuses, that kind of thing, to attract workforce. You know that when you hire traveling healthcare workers, that there's a higher premium paid for the hourly rates for traveling healthcare people. So we're helping the hospitals and other healthcare facilities pay that premium. Every state is seeing that problem, and we're doing what we can. Again, it doesn't necessarily take a 4-year degree. Nursing programs, RNs are 4-year degrees. There are also associate degrees. There are people in the pipeline right now working on a 2-year degree who just need the clinical supervision. So we're working on the hospitals to provide the faculty, essentially, for those clinical supervisor positions to get people out of school and into the workforce. The question is, would we call in the National Guard? Well, the National Guard in Maine are citizen soldiers, some of whom are in healthcare, but if you took them out of what they're doing now, you would be taking them out of healthcare jobs and putting them in other healthcare jobs, so I'm not sure that would make much sense. We don't have a surfeit of people sitting around not doing anything who have healthcare degrees or experience that we can just plunk into other work settings. So yeah, in terms of emergency, that would not be a viable option. Well, let me back up a second. What are the causes of the workforce shortages in the healthcare industry? One, they're pre-existing. Okay, we have tried for several years to get people into the pipeline into healthcare careers, and we're successful in doing that right now. People are getting into those careers, whether it's CTEs or community colleges or university level training programs, or UNE, physician assistants, family nurse practitioners, and doctors. And we enacted several measures this year: tuition repayment, loan repayment programs that are kicking in now, and CNA programs are fairly robust across the state. We're doing those. They don't take 2 years, and a lot of nursing homes are doing training in-house for some of the positions. So we're helping with that. And go ahead. Okay, let me back up. I started to answer the previous question. I'm sorry, and the vaccine mandate is not the cause of workforce shortages in healthcare. COVID is the cause of some of the cause of workforce shortages, exacerbating pre-existing workforce shortages in the healthcare industry. But the fact that patients have gotten COVID from healthcare individuals, bringing it into the facility, that's a problem we want to address, we have to address. This is public safety, this is science, medical science, dictating what we do, and I am very confident that the vaccine rule, as implemented in the state of Maine and soon to be implemented nationally for healthcare workers without a testing alternative, will help keep all of our healthcare facilities safe, keep your loved ones safe when they're required to go to a hospital, clinic, or nursing home, long-term care facility. And that's the highest priority we can have as a community. That is going to also help address the workforce shortages, which are exacerbated by quarantines and by nurses and healthcare personnel getting sick from COVID. We want to address that. We want to stop the bleeding there.